everybody, and welcome to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Kirsten Butz, who's a board-certified psychiatrist specializing in metabolic psychiatry at the Bariatric and Metabolic Institute at Rapid City Hospital. Welcome, Kirsten. Thanks for coming in.
Thanks for having me.
Yeah, absolutely. I was really looking forward to this because we're almost well over 100 now of these podcasts that we've done. And everybody kind of knows the doctors that we've talked to, their specialties and what they do and how they can help, which is all super important. I have never heard of what you do before, which I think is fantastic. So you're local. You're born and raised here, right?
Correct. I'm from Spearfish.
Okay.
But my husband was born and raised here, so we came back technically home.
Well, how did you get into a field like this then? Is this, when you were getting into it, when you were in high school, college, was this your path, or how did you end up here?
That's a good question. So I really thought about medicine a lot in high school, considered that path all the way through college, pursued it, went into medical school, and then considered a couple of different things in medical school. Pediatrics was one of them, and then also child and adolescent psychiatry was the other one. Ended up going into psychiatry, and then when I was in residency, just really enjoyed the interactions that I had with the adults, and so kept adult psychiatry instead of child. However, came back to Rapid City, and in Rapid City, we see all ages. Initially, when I was here, I was in private practice, and I saw all ages, and then I did a lot of inpatient work, and over at the inpatient unit, you see all ages too. So I've gotten the breadth of things. But the specifics about the metabolic psychiatry really evolved over the last 10 years with a relationship with Dr. David Fromm.
So is this a relatively new field? Would that be fair to say, sort of?
That is fair, yeah, absolutely. So metabolic and bariatric surgery is really a new field, but then involving mental health is pretty new. So initially it just evolved out of having a National Institutes of Health, or NIH, guideline of you should screen people for any major mental health issues going into bariatric metabolic surgery. It was a pretty brief screening. And as the field has evolved, we've involved more and more mental health professionals, whether it be psychologists, psychiatrists, therapists, along the roads.
So why is it so different from just traditional psychiatry then? I mean, what in your mind, what is really the distinction between the two?
So there's a lot of things that are not different.
Okay.
When I evaluate a patient, I do a very thorough mental health evaluation or psychiatric evaluation that is very similar to what I would do as an outpatient psychiatrist when I would see someone. But then what I do is an additional evaluation that's really in depth that has to do with their weight history and how that pertains to their mental health. So how do those things interact and connect? And so we have quite a bit more evaluation. We get into the things in their life that have led to weight gain, weight loss, what traumatic events have maybe been a part of that, how has their childhood been a part of that, the ways that they were raised and in relation to food. So we really talk a lot about that. And then we also get into a lot more treatment when it comes to just weight and metabolic health. And so it's really specific to that. I still treat if we find anything like depression, anxiety. We want to optimize how they're doing before they go through metabolic and bariatric surgery. So I still treat that, which is very much just general psychiatry.
Yeah.
And then the part that's really actually very similar to general psychiatry is that the risk stratification part of this is that they have asked me to be an evaluator. So evaluate how patients are doing as we go through the process. Are they an acceptable candidate? Do they have high risk, low risk, medium risk? And that's something that psychiatrists do all the time. That's something that I learned very early in residency. You are evaluating risk, but it's risk for safety usually. Risk for suicidality, homicidality, how patients are doing in an emergency setting or in an inpatient setting. Should they go home? Should they stay? And so that has a lot of crossover. It's just a different kind of risk.
Right.
It's a surgical risk versus a risk of where they're at in their life.
Right. So you kind of touched on it just a little bit here, though. But are there specific mental health conditions that are more common in patients with metabolic issues than you would find in people that just use psychiatry for other issues?
Yes and no.
Okay.
So I do see a lot of the general treatment of depression and anxiety, and I'm able to treat that. And we are working on optimization at all times. So how do we make sure that those are treated before? But then we also have quite a bit more from an eating disorder standpoint. And we're really focusing on disordered eating, sometimes true binge eating disorder, and doing therapy, not only just pharmacotherapy, but also psychotherapy.
Right.
And I really feel strongly that both are very important. And then there's a lot of just general psychotherapy to be done where kind of I did touch on that. Yeah, where is the trauma in relation to weight and what has happened in their life and bullying and the shame and things that have happened in people's lives that are in relation to their weight. And it's a pretty sensitive work that we do there to be able to go to that level to touch on those things with people. And so I take a lot of time in their evaluation and be able to talk about those things.
So what would a what would a process be? Let's say you have somebody that's coming in, that knows they're overweight. They want to do something about it. How does the process begin for somebody like that? Before they get to, I mean, you're not the first person they see, right? So where do those steps begin for somebody like that?
Yeah, great question. Usually they go through a screening evaluation with one of our nurses to first check and see if they have the insurance capabilities of getting the surgery. If not, and they're just interested in medical weight management, that's also wonderful. We have an entire arm and an entire team of people that provide just medical weight management. And then if they decide, okay, maybe surgery is something that I'd like to try, then they see a consultation person from our surgery team. And then they're referred to me for as a part of the evaluation as well. I see everyone a minimum of 3 times, which is 4 hours of my time with them. So oftentimes I'll extend that a little bit if I need to. I never see them less than that. I really feel like that is the absolute minimum that I need to be able to get to know someone and understand where they're at in life. And so I do that across the course of a couple of months.
Right.
Yeah.
So it's not just, we've been kind of focusing on surgery for people that seem to be overweight, but you do work for people, anorexia, bulimia, similar stuff like that as well. That same kind of, is it a similar process?
So it would be more if that developed after surgery.
Oh, I see.
don't see them initially. That's sort of outside the scope of what we can do in our clinic right now. Okay. But I would see them if those things develop, which they do after surgery. I have some people who I'm helping with those things right now who they have developed those issues after surgery, and so we're working with how that happens.
Does that happen?
It does occasionally.
Sometimes when you have
rare.
the surgery and you lose the weight and then you just mentally take it too far then at some point, right? Is that kind of what it is?
To an extent, yeah.
I didn't explain that very well, but
no, it's fairly rare. But it's just where it's difficult to see the changes that have happened, and so that's my role and a role of a therapist to help see those changes that have happened, and then also treat any mood issues that may be along the way. And then if there are things that we can do dietarily, we have a phenomenal dietary team who is also helping to make sure that the caloric intake is correct and that kind of thing. And it's a very sensitive thing because after weight loss surgery, there are a lot of changes in the body.
That was my next question for you, too. So it seems like everybody that talks to you, gets ready for the procedure, has the procedure, and when it's done, sees the results. And it seems like almost everybody would just be super happy with that and there wouldn't be any issues. But obviously, that's not how it works for a lot of people. I suppose that can be such a drastic change that it's hard, to go into that next day, right?
Yeah, it can be hard sometimes. And so a lot of the work we do is to try and prepare for that. I have them do a lot of education. We talk a lot about the changes that are going to happen. And there is some version of when you see those changes in yourself, how do you view them? We have to really work with that sometimes after surgery, and those changes are real. There are excess skin issues and things like that. And so how do those weave into the idea that those things actually happen versus is it a dysmorphic idea in their brain?
Yeah.
And that's a very big distinction that I work with them on making, and then also help them see a therapist therapist who can further work on that. But then also there are things, we refer out to plastics for changes in their skin surgery after they have significant weight loss, and they can help in that regard too. And so we do see sometimes where people are seeing things that they weren't really expecting.
I suppose. Because, you're used to that body, for years, if not decades sometimes. And then all of a sudden it becomes, you must feel like you're a stranger in it.
Yeah, there
probably.
is some, foreign feelings at times, and working through those and how do we really get to that change. And a lot of the work we do is on the prep side, but there's been a big swing, especially just recently in this last year, on how do we do the work on the backside too? How do we do the long-term work with people who have those kinds of feelings, or how do we continue to do the work to make sure that the weight loss is long-term, not just a year out, but 5, 10 years. And so that's kind of, I think, where we're hitting the cutting edge with weaving in the mental health part and the lifestyle change part into the bariatric world. It's just getting patients to continue to follow with us. And most of my patients are very happy when I say, this isn't the end. At the evaluation time, I say, you're going to have surgery, but my door is wide open. You can come back and see me if anything comes up after surgery at any time. And they will. They'll contact nursing staff, and then they'll come back if they need help.
So, because like you said, bariatric surgery hasn't been, it's a relatively new field, isn't it? I don't think it's been around a super long time. And of course, it just keeps getting better and better with the new technologies and everything we do to help people that want to come in and have it done. But I'm assuming that adding the psychiatric aspect to it, the outcomes have to be so much better. Do you see much better outcomes because people can, just talk to somebody about it?
Yeah, we're hoping that that's the case, and we're starting to do some studies, long-term studies in the academic centers that have shown that the outcomes are better, and they're even better when people have long-term follow-up. And so that's sort of what I was saying before, is that the idea is we can weave this long-term follow-up in for people. And that's sort of the idea with psychiatric illness too, that depression and anxiety are there. They're oftentimes very treatable if we can get the right therapy, the right medications, but they are still going to be there. And same thing with some of these eating patterns. Many things are changed for these patients afterwards, but some of the tendencies are still there. And so it's a lifelong process, and there's no sprint about this. It is a marathon forever for them, and so we want to be there to help them. And I think that's one of the best parts about our programs. We always say that patients are, they're there for life. They can come back to us at any time for help with any of these things.
Now, is the Bariatric and Metabolic Institute, which I can't believe I didn't realize right away that it comes to BMI, which I think works really well in this situation. A lot of people, of course, know the BMI from the metric that they use for, the cheap scales that you buy that tell you, oh, you're too high. See a doctor about that. Don't trust all of that kind of technology a lot of times. But is this a relatively new institute at Rapid City and Monument?
Relatively. So Dr. Fromm was the initial person in our group, and he came over, I would say, probably 2 or 3 years before I joined, and I joined in 2021. Okay. And so he was the really founder of this, and then he created the team, and like I said, I had a relationship with him back from when I was a medical student, one of his students rotating with him on the surgery rotation, and he has asked me to be a part of his team for the last 10 years. Mm-hmm. So we joined together in 2021. We now have, and he brought also his team of wonderful physician extenders. And then he also brought on a second surgeon, Dr. P.L. Hope, who I know has been in and done a couple of things. And then we just brought in a family practice physician, Dr. Kyle Larson, who's going to be helping with our medical side of things.
So it seems to be growing for sure.
Absolutely. Yeah. Yep. And we always have patients on the waiting list, and it's a really, I think, a beautiful addition to the community to be able to have this resource. It is.
What advice, what is like the one really great piece of advice you want to give people that are looking to start this journey, that are listening right now and want to hear, what you would say?
Yeah, that's a great question. With a lot of the work that I do with lifestyle change, we often talk about forming new habits because we're trying to change old habits. And so with new habits, we often talk about how do we create these. And I do a lot of things with habit trackers and lifestyle changes. And the idea becomes that our lifestyle is really a collection of the different habits that we form over time. But this is not something that changes very quickly. It's not something that we can say, oh, I did this for 30 days. It's a quote unquote diet. This becomes a long-term plan. And the way that we have success is that these things are instituted in our daily life over and over and over. And so that's something that we work on a lot, is how do we create these new habits? And then how do we really find the success in those habits and what we call them specifically in the psychological world is non-scale victories. But when someone makes a big change in their life, how do we celebrate that and say, okay, this is beautiful. You really did a lot of things different than you were doing before.
Yeah.
But this is a new habit for you. We're going to continue this. And this is how you become successful.
So that seems hard. God, making new habits is so difficult, no matter what you want to do. But I suppose you have to take that first step. And I guess if you're considering something like this, if you want to think about surgery, talking to somebody like you, it isn't dumb to think about, like you said, what new habits can you start even before you begin the process, right? Whether it's just a habit of, I don't know, taking a walk if you can, or eating a little bit better. We all should do that. There's no question about that. But yeah, that's great advice right there. Just start the new habit before you even come in and talk to anybody. But do you generally go to your like family doctor to get the process started first, and then it kind of goes from there?
Yes.
Okay, perfect.
Usually they are the referral source. Absolutely.
Excellent. Awesome. Well, do you have, are there anything that gets you excited for the future of this field then? As I'm assuming this is what you're going to be here in Rapid City. So what are you looking forward to? Is there exciting things?
Yeah, absolutely. That's a great question. I hope that this is my next 20 years of practice. And I think there's going to be a lot of change. But I really think what we're going to see more and more is optimization, not just short-term, but long-term. How are we going to make sure that our outcomes are really sustained over the long term? And that kind of goes back to that habit change. And we make a ton of physiologic changes when someone goes through a transformational surgery like this. And so those physiologic changes are really sustained when we also combine the lifestyle changes with them. And so how do we help do that, at least from my standpoint?
Right.
And how can I be a part of that for these people's lives forever? And so how do I not only just be the evaluator on the front end, but how do I then go back to the general psychiatry world of being a part of these people's lives for the long term?
Yeah. Well, it's awesome that we have something like this here in Rapid City too. This, I think, will be super beneficial, and now kind of getting the word out that a place like this exists too. Because again, I was surprised that we had something like this here. Surprised that you are a board certified, well, not you specifically, but that you're a board certified psychiatrist specializing in metabolic psychiatry. That is a fascinating field to me. So, Dr. Kirsten Butz, thank you for coming in and talking about this. I know that we can get a lot deeper into some of this stuff later, so I'd love to have you back and do some more of this. Now that we all kind of know what you do and what is available here in Rapid City, we'll drill down and find some more cool stuff to talk about, okay?
Absolutely. Thanks for having me.